Senator Jones, thank you for introducing SJR 7. This is a violation of the people of Ohio, this passage of this health care bill in Congress this past week. Many Ohioans and many Americans across our country were stunned and in disbelief as they saw the actions of the United States Congress on Sunday evening. Many of them watched and in horror to see that their individual constitutional rights were being violated. In the words of President Garfield, President of Ohio, U.S. President, "A nation such as this, where the people choose their leaders, if the Congress be ignorant, reckless, and corrupt, is because the people tolerate ignorance, recklessness, and corruption." What we see happening across the country are people beginning to speak up. This is a health care bill that people did not have time to vet, to see and investigate what was in the details of this bill. People have been clamoring for months to find out what the details were. One committee chairman in Congress was so audacious to say, concerning the rules of Congress, we make them up as we go along.
Like Paul struck from the donkey on the way to Damascus, that they will see the light, that the Democrats running the House, the Attorney General's office, the governorship will realize that the majority of Ohioans are not happy with the process. They're not happy with the way votes were bought. They're not happy with the state of Ohio typically having to pay for the share of Medicaid from Nebraska. You have to question the legislation. When you pass a bill that you have to fix before you pass it, it's clearly a bad bill. That maybe if they would put politics aside for a minute and think about the people of Ohio, that they will see the light and support us in taking these efforts to provide a firewall for Ohioans, so that at least in Ohio, citizens' rights to liberty and choice will be protected from what's going on in Washington. Senator?
I don't have much to add other than to say, look, we have to be vigilant now. I mean, the call is ours as everyday citizens, as members of the legislature. I'm certainly going to do everything that I can to fight on as many fronts as I can. I can't do it alone. That's why, you know, as Senator Grendell said, we certainly support efforts by the people to try to get the constitutional amendment before them, in addition to us trying to get the amendment before them through the legislative process. But we've got to be vigilant, as Senator Grendell rightly said, the fight has just begun.
That everybody would pay into to cover these growing, ever-increasing healthcare costs.
First of all, I didn't agree that the governor of Massachusetts was necessarily Republican at the time of his views. I will say the same thing about maybe the other governor candidate you mentioned. But having said that, here, it's a question of compulsion. Can the state of Ohio come up with its own program when it comes to a optional medical care for people who need it? Yes. Can the state of Ohio make you or me get medical health care insurance? No more than the federal government can. The Liberty Clause didn't get defeated at the Pennsylvania line, and it actually repeats itself in Article 1, Section 1 of the Ohio Constitution. So yes, the state can have its own standby program, a program to help address the issue that Jim raised, which is health care for those who need it, but you can't compel anybody to get health care. You can't compel people to get oil changes for their cars. You can't compel people to do things under the guise that it's good for the national good and the public good when it comes to taking away individual liberties. Because once you start down that slope, whether it's health care or eating ice cream, which is my shortfall. Once you start going down that slope, then where does that stop? And whether it's Congress or the Ohio legislature, we ought not to be taking away people's individual liberties.